Hello, my name is Oriana. Welcome back to my channel. Today we're going to be talking about how to get baby deeper into the pelvis so that way you can progress labor or even try to stimulate labor or just try to make sure that your muscles are able to handle the different stages of labor. Now, this is something that I love giving education on to my patients so that way it can try to make labor a little bit less scary, a little bit easier to navigate. And you can also practice these moves leading up to labor to make sure that your body is able to do what it needs to do to allow baby to come through. We're going to be talking about the different levels of the pelvis, what type of moves you should do with your legs to help out with those, and then I'll give examples of exercises for that. So first things first, we want to think about baby's position to start off with. So hopefully baby is LOA or ROA. LOA meaning that baby is at the front of the left part of the belly, or ROA meaning that baby is at the front of the right part of the belly. It just means that you can basically touch the baby's spine along your front belly. We don't really want baby to be facing posteriorly where their spine is along your spine, because that can lead to other complications. Maybe it can make it difficult for them to travel through the birth canal. Maybe they can be born sunny side up. We want them to be more facing on the front, and I will have other videos showing you how to facilitate this, but hopefully baby's in a good spot. And the cool thing about the pelvis is that it has two different ovals. So it has this oval going one way, and then it has the other oval going the other way. So you see two different ovals, right? So baby has to transit through the pelvis by going through those ovals. Therefore, baby's gonna do 2 rotations to get through, and we want to basically help baby get down that way. Now, I want you to imagine that I have little hip bones facing off of this pelvis. I don't, but just imagine that I have little hip bones off of this pelvis. And basically, whenever I open up my hips, so I'm basically making my knees go out away from each other, whenever I do that, then I am actually opening up the front of the pelvic floor. So if you look at this, you're going to see opening up the front of the pelvic floor. You see how right through here, it gets a little bit wider. So that's happening. But also, whenever I open up my knees out, then baby has more space to get into the pelvic inlet. So whenever you're trying to get baby to engage during birth, if you're trying to, trying to avoid induction, or even if you are going to be induced in the very beginning of that induction, you want to do activities where your knees are going out, toes are going out, knees out, toes out. And I'll try to put a little image right here of that. But you want to have knees out, toes out, so that way baby can get down into that pelvic inlet and begin to engage. I'm fighting with my lighting here if you can tell. So the next part is going to be the mid pelvis. Now, how we get baby through that is by shifting. If we do these little funky shifting movements, then we can go ahead and get baby down. That's why you'll see things like curb walking, and I'll put up a little image of what I have here. But you'll see images of curb walking or going sideways up steps. There are other different types of motions that you can do as well if you don't have those accessible for you in the moment, or if you don't want to go outside. Then you can also do other motions, but we basically want to shift baby deeper. That way baby can actually shift deeper into that mid pelvis area. And then we have the pelvic outlet. And so again, imagine that I have little leg bones on here, and I don't, but pretend that I do. If I move my knees in, so like that, you'll see that the back of the pelvic floor actually gets bigger. So if I open this up, you'll see that the back of the pelvic floor gets bigger. And even though baby comes down through the vagina, the back of the pelvic floor is what's stretching quite a bit. And so we want to allow more space. We want to be able to put that tissue on slack, or just allow that tissue to be stretched so that way baby can get through it. So we want to do things where knees are in, feet out, and then baby can come through that pelvic outlet. So here's some moves that you can do. You can either grab your exercise ball or a stool, and it doesn't matter what type of stool, even if it's like a low ottoman, whatever will work. You want your knees to go out, toes out. Now, ideally, your hips are up higher than your knees, which is why a ball would be better. So if you are going to sit on a stool, if you could put it up a little bit higher so that way your hips are at least level. We do want to try to avoid this huge posterior pelvic tilt, because that can push baby more towards the back of the pelvis when we're trying to get baby towards the front, like we mentioned. But yeah, you can go ahead and sit down into a deep squat and do some deep breathing here. You can do some actual squats, like just going down, up and down a few times, or you can sit on that exercise ball with knees out, feet out. You can do some little bouncing if you're trying to induce labor, and then take deep, deep breaths. The next part is going to be using that exercise ball to rock side to side. So we're going to do that shifting through the pelvis. You want your feet to be not going in the same direction this time. And we're going to be shifting. So we're going to be going through what we call that frontal plane motion. So you can have your hands on your ball and then go in and out of a deep, deep lunge, right? Or you can go outside and go side walking on some curbs, or you can go side walking on some steps. And whenever you do this, as you go up, you can go ahead and make sure that your butt kind of tucks under just a tiny bit, because if your butt tucks under just a tiny bit, then you allow a little bit more pressure to go onto the cervix, so that way you can put more pressure down. That way hopefully it faces and dilates. Then the next part is going to be that hip internal rotation position to try and get baby through the pelvic outlet. So we want to think about knees in, feet out. Knees in, feet out, right? So you go ahead and do this on your hands and knees. You can grab your exercise ball and then you can rock back and forth. So it would look like this. So I'm on my hands and knees, feet go out, and then I can just rock back and forth. And it should feel really good on your low back, especially towards the end of pregnancy. So you can do that. And then I have one more variation for you to work on that hip internal rotation to make sure you have it for childbirth. What you would do is you would have your foot up on a step or a block or a book, whatever you can find. And then you would just think about shifting your hip back as you rotate your hip in. So I'm shifting my hip back and I'm rotating my opposite hip in towards that leg. So shifting hip back, rotating in. And you can practice this. You can even take deep breaths. You can take deep breaths into like this lower buttocks area. And then come back up, okay? And then that will help you make sure that you have the hip internal rotation that you need for childbirth. I think I'm running out of daylight here, so we're gonna go ahead and end this video, but these are very simple moves that you can do. They should be accessible for almost everybody. If you have a hard time being on your knees like that, then you can always have, a pillow underneath your knees, or you can go ahead and stand at the table or your couch or anything like that, the bed, have the ball up on the bed, and then just have, again, knees go in, feet go out, knees in, feet out. That's like super important for childbirth to try and help decrease chances of tearing through the pelvic floor. So you can go ahead and try that out if the knees don't feel good, but everything else should be pretty accessible for you. And these are all moves to make sure that you have every single plane of motion that you need for baby to get through the birth canal properly. So I hope that helps. I am a TikToker who came over here from there, and I'm still figuring out this whole YouTube thing. So if you have any feedback, I would love that. You can go ahead and like, comment, share. Let me know what you're interested in. I have a whole year's worth of information that I'm so excited to share with you this year on hopefully one video a week. I plan on going over things that I get asked frequently in the clinic, or things that I get frequently asked online, or things that I just am so passionate about educating about. This month I'm going to try my hardest to get out all the birth prep, not all of it because I have a course if you want to get the course, but I am going to try to get out some big topics that I go over in my birth prep program, and whenever I'm educating patients on birth prep. So I hope that you want to go ahead and join, share this with people. I think people don't know what they're dealing with whenever they go into labor, and it doesn't have to be scary. It should be something that you feel like you can have some sort of control over, even though we don't. It should still feel like something that you are prepared for. And there's so many resources and information out there to help you out with that. And I just hope that this can at least get that ball rolling for you. So I look forward to seeing you in the next video. Bye-bye.